this video is for anybody who has Achilles pain or Achilles tendonitis who is over the age of 65. And the reason I decided to make this video is we often get questions from people looking at our website saying, oh, we can see you're treating young active people, but how do you treat people who's older, who's got Achilles pain? Now, the things we're going to talk about is one, why age isn't really the thing you look at when you think about Achilles rehab. Two, certain things that you do have to keep in mind with regards to older age, but things like medication, for instance. And then thirdly, we'll look at general exercise advice for people who are older in general, because there are certain things that applies to you. You'll have more niggles that you feel and how to interpret that and what type of exercise is the best and how to increase your exercise levels without actually getting injuries like Achilles tendinopathy or tendonitis. And then lastly, we'll look at Achilles tendonitis rehab specifically in people who are a bit older and how you have to adapt it and the things you've got to keep in mind. For those of you who don't know me, my name is Maryke. I'm one of the physiotherapists from treatmyachilles.com, where you can get online physiotherapy assessment as well as treatment for your Achilles injuries. Have a look at the description of this video if you want a link to our website. I should also say, this video is going to be long, so if you don't feel like listening to all of it, I have put chapters in the video as well, and you'll find those chapters in the description so that you can jump to the bits that you're interested in. Age is not really the main factor that we take into consideration when we prescribe a rehab plan, because you can get two people of the same age and one can be really fit and strong and active and the other one can be quite weak compared to this person. Also, one person's tendon may be super sensitive to load because it's really flared up, and the next one may be able to tolerate quite a lot of load. So they can't get the same exercises prescribed to them because the one will get worse if I prescribe too hard stuff, and the other one will actually just not get better because it's not hard enough for them. So the thing we look at is how fit and strong are you, and we do that through, well, obviously having an in-depth conversation to understand the situation around your circumstances, but also getting you to do certain tests and movement tests to see what strength do you have. And then also we look at the sensitivity of the tendon, because some tendons can be really super sensitive and flare up easily and they need a very slow progressive program, and others need a bit of a slower, a faster one. But I'll talk about this in a lot more detail under the last section where we're going to talk about Achilles rehab specifically. The one thing that age does tell us, that if a person is older, it is that their body repairs itself more slowly. So if we think of what happens when you do exercise or any physical activity, your body always sustains a little bit of micro damage when you do activities. And that's normal. Our body is forever turning over cells and taking away old damaged ones, putting in strong new ones, and that's how we grow stronger. Now, that process of repairing itself becomes slower when you get older. So what this means is that when we look at the treatment plan for an older person, we likely will factor in more recovery time between hard bouts of exercise, because we'll know that actually this person may require a bit more time between their sessions. We'll also not expect them to progress as quickly as somebody who's younger. But again, there's no thing of so many weeks on this program and then progress on. We always use targets, and we'll see you reach your target when you reach it, and you don't push too quickly. You have to keep things that it doesn't actually increase your pain. So you go at your own speed. But those are the only two things that age really affects. It's how quickly you can progress and how much recovery time you need after exercise. There are, of course, other things that comes with age. Things like you're more likely to be on certain types of medication that may affect your tendon health. So it's important that your physio also asks you about medication. Now, some of the most frequent things that people get prescribed as they get older are statins. Statins are medication that can lower cholesterol, and there's a bit of a debate about whether it's actually needed or not to help prevent heart disease. But they can also affect tendon health. And I've made a whole video about statins and why they may affect your tendon health. So if you're on those, it can be part of the reason why your tendon flared up. Same thing for corticosteroids, whether it's inhalers or tablets that you take. And also there are certain types of antibiotics that can cause trouble. Now, I've made videos about all of these medications and I'll put links to them in the description of this video. But it's important that if you're on any of these medications, don't just stop them. Go to your doctor and have a discussion first, because it may have serious medical implications if you just stop your medication. It's just important to understand that these things can affect it, but it doesn't have to affect it. The person who emailed in and gave me the idea to make this video, one of her main concerns was that she, like many other people over the age of 65, she doesn't really do any vigorous activity. She doesn't really go for runs or anything like that, but she does walk for an hour a day. She does her normal chores, and her Achilles became painful when she increased her walking and decided to do a bit more exercise because she felt she was losing strength and wanted to be stronger. Now, this is actually a really common scenario that people tell me about, that you reach an age where you go, life is becoming a little bit more difficult. I can feel my muscles aren't as strong. My knees are hurting a little bit. I'm getting niggles in my feet. So I want to do some exercise to help this, to fix this. But then often they jump into it too quickly, and then they end up with an injury like Achilles pain or something like that. So I wanted to talk about exercise and what types of exercise is best and how to safely increase exercise when you're a bit older first, and then we'll get to Achilles treatment. So if we can get back to thinking about what happens when we do exercise. Whenever we exercise, you get a little bit of micro damage in your joints, your tendons, your muscles, everything. Now that sounds bad, but actually it's good. It's the way that the body realizes those structures aren't strong enough, and then in the period after the exercise, it repairs it and it makes them stronger than before. So if you allow your body enough time to recover after a bout of exercise before you do another one, you're going to gain strength in your tendons, your muscles, your joints. And that's the process through which we grow stronger. Now the problem comes in if you suddenly increase your exercise load on those structures and you don't allow it enough time to recover. Then you accumulate the micro damage, and that's when you get overuse injuries like joint pain or tendon injuries and tendonitis. Now, the problem is that this is not an exact science. There are different things that determine how quickly you can recover. Now, yeah, we've spoken about age, that age is one thing. The older you get, the longer you need to recover, but actually also fitness levels. So the fitter you are, the more exercise history you have, so the stronger all your structures are already and the better they are at repairing. So the fitter you are, the less recovery time you usually require. But then also just genetics and diet can have an influence on that. If you're not getting enough nutrients in your diet or you're vitamin D deficient, that can impact it. So if you think that, I wonder if my diet is sufficient, speak to your doctor or a dietitian. They'll be able to sort that out for you. Then if we think of the type of activity as well, if it is classed as a high intensity activity versus a low intensity activity, a high intensity activity requires more time, so usually up to 48 hours after a bout of exercise then to recover fully. Whereas a low intensity activity requires only about 12 to 24 hours to recover from. But the other thing to take into consideration here is what is deemed as a high intensity activity for you will depend on your training status. So for somebody who's really fit, going for a walk is an easy activity. For somebody who's been really sedentary for the last 8 weeks or so, and then suddenly goes for a walk, that can actually count towards a high intensity activity for them because it's a total new load that they get. Then something else to keep in mind is that it's not just the exercise you do in that day that counts towards your training load on your body. It's actually all the activities you do that works the same body part. So if we take walking, for instance, if you walk in the morning, you exercise your legs and your back a little bit as well, and your cardiovascular system. Now you do some gardening and you do some housework. Guess what? It's time on feet. It counts towards that. And then you decide to put in another walk in the evening. So that's another load on top of that. So you can see that in that one day, your training load is really quite large. Now, if you have not been walking regularly for the last 6 weeks or so, you will not have a lot of capacity yet to cope with that much time on feet in one day. So that can cause overload. So when you think of your activities that you're starting, think about what have I been doing in the last 4 to 6 weeks, because that gives you an idea of how much your body can safely tolerate in a day. And then when you think of how you want to increase it, try to not increase it in big jumps. Try to only do a few minutes more in a day. And they usually, for runners especially, they talk about not increasing it with more than 10% per week in distance. So if we think of time on feet, if you are used to walking for half an hour a day and doing a certain amount of time on feet just doing shopping and things, then think about if the next week you add in another half an hour later later in the day, so you're walking twice a day now for half an hour, you've actually gone and doubled your training load. So a safer idea may be to start with 15 minutes in the evening then, but only on 2 or 3 days of the week, and giving yourself more recovery time in there. Something else that can come up when you get older is that most of us end up with a little bit of arthritis in our joints and our feet and knees and hips and whatever. So when you train, you may be feeling niggles as you go. And it doesn't mean that you need to necessarily not do that exercise. So what niggles are okay to feel and what niggles should you listen to? The rule is usually that if you're feeling a bit of discomfort, but that discomfort changes where you feel it as you walk. So say, for instance, you're walking and you can feel, my knee is niggling a bit. But then 2 minutes later, you realize, knees now stop niggling. I can now feel my left foot niggle a bit. And then that goes away and you can feel something else a bit. That is usually okay because it's just the receptors saying, hoi, we're here, hi, we're here. Now, also, the other thing that goes with that is after you've stopped walking, you don't want to feel a significant increase in discomfort in any part of your body in the hours after that walk. So say, for instance, you go for a walk, you feel quite a few niggles, but then after you stop, not too bad, maybe a little bit more discomfort. By the next day, you feel absolutely normal again. Then that walk is possibly absolutely fine to do. However, if you go for a walk and you have these little niggles, but they go and come, and then you stop, and then later in the day you think, it's really uncomfortable climbing stairs now. And especially the next day you think, I can feel I walked yesterday. Then that walk may have been a bit too much and you need to possibly adapt it for the next time. So you need to think about, do I need to do less? Is it just that I did too many days in a row? Should I have done it every second day perhaps? But yeah, that's usually a sign that maybe you're overdoing it for your current level of fitness. Something else that can be useful is if you think of actually varying the type of exercise you do. Again, walking is the most common thing people do because it's so easy to do it. You can just go out and walk. And a lot of people don't like going to the gym. They don't like doing other things like cycling on a stationary bike. So they tend to just walk. But the problem with that is it always exercises the same part of your body. So if you could alternate and add in other types of exercise, like for instance, one day you walk, next day you may go for a swim or even a bike ride, then that can really help to feed your joints, but not have the same impact every time. Also, if we think of what the research is showing with regards to what type of exercise is best for older adults, it's usually a combination of 3 things. Strength training, because it's natural that we tend to lose muscle strength as we grow older, but they've shown that actually if you do some strength training, you can limit how much you lose. And with strength training, you don't have to think heavy weights. Yeah, absolutely, it would be brilliant if you can build up to heavy weights. But even doing body weight exercises and things like Pilates, all of that counts towards strength training. Then you want to incorporate an element of balancing exercises. Now, whenever I say balancing exercise, people immediately think standing on one leg. Don't do that if you've got bad balance or you've not done balancing exercises, because you will likely fall over and injure something. When you start with balancing exercise, you have to start at the level that's right for you. So if that means you need to have a bit of a hand on a wall to get your balance right and to be safe, do that. But it may be best to actually speak to a physio and get yourself assessed that they can give you exercise that's right for your level, or join a Pilates class or a yoga class or a Tai Chi class. Tai Chi has very good evidence behind it that it provides muscle strength and balance and prevents things like falls and loss of balance as you get older. Then the third element is cardiovascular exercise. And cardiovascular exercise is anything that just gets your heart rate up a little bit. It doesn't have to be vigorous. It just has to make it that you get a little bit out of breath as you go, but you still need to be able to have a conversation. So things that fall into that category is obviously walking, cycling, brilliant option because you get lots of movement which feeds the joints, but you don't have the same impact as walking. But the impact of walking, of course, is also important because it helps stimulate your bone growth and helps your joints be nice and strong. Swimming is an option for cardiovascular exercise, cross trainer, anything that will get you a little bit more breathing a bit deeper than just sitting on the couch. If we think about Achilles tendonitis rehab specifically for older people, then the treatment is basically the same in that it has to combine relative rest with strength training exercises. So let's look at what each of these look like. Relative rest means that you don't rest completely because actually that makes tendon pain worse, but you have to reduce all your activities, and that includes your rehab, your walking, your daily life activities, to a level that doesn't irritate your tendon at the moment. Because whenever a tendon is injured, it loses some of its strength. So then if you try to load it as much through as many activities as you want to do in a day, it now becomes painful. So you have to figure out what level of endurance and strength does it have at the moment. How much walking can you do? How much time on your feet can you do that doesn't actually irritate it? So the way to do that is keep a pain diary. Log in there what you've done in a day, because it's amazing how we forget what we've done in a day. And the things we're looking for is how much time did you spend housework? Did you go for walks? If you did you walk fast? Did you walk slow? For how long was it? What shoes did you wear when you walked? Because all of that impacts it, because it may be that you think walking hurts. But actually, when you go to look at it, it's when I walk in my flat shoes, which will put more strain on the Achilles, and I walk for long periods of time, and then I do the housework on the same day, then walking hurts. But it may be that if you wear your good shoes, your running shoes that has a little bit of a heel to them, and you walk a bit slower and perhaps not for that long, you can walk without pain. And that's important to identify that, because actually walking becomes partly part of the strength training and rehab for Achilles tendinopathy or tendonitis, because you can use it to slowly build your tendon's tolerance to walking again. I'll talk to that in a little bit more in a minute. So then that's the one part, relative rest. Identify all the activities that makes it worse and cut them down to a level that doesn't make it worse, so the tendon can actually have time to settle down and calm down. But now your tendon has lost some of its strength, and because of that you have to do specific exercises to rebuild that strength, and these are typically Achilles tendon loading exercises. Now, depending on your current strength and your tendon sensitivity, you may get prescribed very different exercises from the next person whose Achilles is injured. So let me give you an example. If somebody has a super sensitive tendon that's really painful, we may start them off with heel raises just done where you go up and down on your toes just sitting like this, or even standing just slowly up and down. Some may just do where they go up and they just hold the position. We call them isometrics. Whereas if your tendon's not really that painful and it takes quite a lot before it gets painful, then you may be able to, and you're quite strong, you may be able to start with single leg heel raises already. Depending on whether your pain is at the heel or slightly higher up in the tendon, you may be given exercise that's done over the step. But if it's at the heel, it's only going to be to floor level because it will hurt it more if you go over the step. So you can see there's lots of variations here, and the way that we decide what is right for the patient is we listen to what you tell us about what activities causes it to hurt, but then we also test your strength to see what are you able to do and how does it affect you when you do that, because that will tell us where you start. But then that's the starting point. Then you have to slowly increase the load to get to the point where it's actually strong enough to do all the activities you want to be doing in a day without flaring up. And that is where the activity level of the person makes a big difference. Because if you're somebody who just wants to go for walks, versus somebody who actually wants to run and do more intense sport, it doesn't matter that you're 65 years old. You two will have very different exercise programs to follow, because the person who just walks and just wants to walk won't get any plyometric exercises or really high load exercises in their program because they don't need it. Whereas this person, if we don't put in plyometrics and high resistance training for them, they won't be able to tolerate running loads. So that's quite important. Now, throughout this recovery cycle, the other question the person asked me was, is it best to, first of all, should she put recovery days into her week? So if she goes walking, should she walk every day? Is it best to not walk every day? Or can she go back to putting walks in the evening in as well? So the answer to this is, oh yes, and the other thing is, can she, on the days she doesn't walk, are those the days to do the rehab exercises on? Yes and no to all of those. Let me explain why. Usually, your rehab exercises will consist of two parts. I say usually because not everybody tolerates a two-part exercise program. But you may likely have exercises in that program that's really low load and just there to help with circulation. Typically double load things that doesn't even feel like work for your Achilles. And those can be done every single day because they won't cause a lot of micro damage. They will actually just get things going. But then there will be high load exercises that's specifically designed to strain that tendon a tiny bit more, but they will be at the right level that they don't actually increase your symptoms, but that they can stimulate tendon growth. And when you do those exercises, it's usually good to do them on a day where you're not doing a lot of other activities like walking that also works the Achilles tendon. So yes, in that sense, your high load exercises are best done on days that you don't do a lot of walking, but your low load exercises can usually be safely done on the days that you do walk. Then, if we think of how many times to walk in a week, you want to think of that total training load in a day. And you want to also make sure that you have times in the week that you can do your high load exercises, have times in the week that you can walk, and then have days where actually you just give it some rest. So it may be that you do a day where you do a longer walk. The next day could be a shorter walk and your Achilles exercises. And then the third day, possibly a recovery day. Now that recovery day doesn't have to be total rest. It can be that you go swimming or you go cycling, but just not a load that loads the Achilles tendon. Then with regards to, can you also put a walk in the evening? I would make very certain that you are first used to doing your regular walks day by day, plus your Achilles rehab, and you find that easy. And then I would consider adding in a small walk in the evenings, but not every evening. And I would only make it a really short one to start with, so that you think of that total increase week on week, that it's not by that much. So even though you don't see a 5 or 10 minute walk as something that's useful to go out for, that may be something that you have to start with. So that evening walk extra in there, only once you're totally comfortable with the rest you want to do, and you've done that for several weeks, so that you definitely know that you're used to that training load. Excellent. Hope you found that useful. Now remember, if you need more help with an Achilles injury, you're welcome to consult one of us via video call. The link is in the description of this video, but also if you have any questions, you're welcome to ask them in the comments. Take care.